looks
Yeah,
pretty good. What is that?
it's the good stuff, man.
Is that your Nicorette gum?
No, no,
Little nicotine
no.
gum?
I wish a cardiologist who is trying to quit smoking. You know,
I know, right? Do
no,
as I say, not as I do.
no, no. That's my idea. Hey, smoking kills. So, so no, that's my nicotine gum. No, I'm kidding. It's my caffeine pills that I'm taking. This it's too late, man. I'm tired. I've been tired, uh, just exhausted. And these things, this neurogum thing, I found just a little bit of mint helps me just stay awake and like get that jolt of energy. Which
Yeah, man, it helps when we're recording these late at night and it's a long week already.
Yeah, yeah. I mean, long week of writing notes and uh, seeing patients, talking to like 20, 25 patients a day, writing all their notes. I use a lot of AI softwares and doing my notes. And even then, I'm still so behind. I use so much
Dude,
technology.
I hear you. The note writing is the worst.
Is the
What
worst.
AI stuff are you using? I haven't actually dabbled into AI. I'm just hand typing all my notes and it's killing me.
Yeah, I mean, as you know, I'm a pretty early adopter in a lot of things. So I started using a lot of the AI speech to text softwares, and it's not really speech to text; it really understands what you're talking about. So I started trying them out almost a year and a half ago, or a year and a few months ago.
You've been using them for a while.
Yeah, I've been using them for a while. I've tried maybe 4 or 5 different ones, and uh, finally found one that suits my practice and suits my style, and I started using it. I've been using that one consistently for 6 to 8 months, and it's interesting. It took me a while to find the right one, and I tried different ones. So I used one software. I like it for a while. Then someone suggests, oh, maybe this one's better. I get an Instagram ad about a different one, and then I try it, and I always come back to this one. So
So the
it's been
Instagram ads
interesting, man.
work, huh?
Huh? Yeah, it's awesome, man. I think it's changed the way I do my clinic. I mean, a big complaint of a lot of patients is that they go to a physician's office, they wait in the waiting room for 45 minutes, 30 minutes, 45 minutes. They get room, then they wait in the room for another 30, 35 minutes, 40 minutes sometimes. For some doctors, not for me. But when the doctor comes in, they're on the computer just typing away and not even looking at the patient. There's literally patients that told me the doctor did not look at me in my eyes or at my face a single time. He was just staring at his computer. And I think that's changed a lot with me. And there's a pressure on us on doing our notes and documenting everything. Um, but with the AI softwares that I've been using, it has been pretty amazing in the sense that I can just get there, turn it on. It's pretty HIPAA secured, where all the data is secured. There's dual factor authentication, and the data gets deleted once I'm done with it. But I sit there, I turn it on, and I just talk to the patient, look at them, talk about other things, talk about sometimes the favorite sports teams, what they've done, what they do, what their job is like, and also talk about cardiology. But it kind of you know no, listens to the conversation, and then creates a whole soap note for me at the end, and remembers all the details and forgets all the fluff. So which is pretty amazing. And the best part is you can talk in any language and it records it and changes it into English and makes a soap note out of it.
Man, that's awesome. I mean, it's very much creates an impersonal atmosphere in the clinic. Like for myself, sometimes when I'm trying to juggle talking with the patient sitting in front of me, doing the physical exam, which that part in orthopedics, it forces you to have a little bit of a personal touch because you're actually touching the patient. You got to look at them during the exam, but then you kind of go back to the computer and you're typing notes. You got to quickly type out because I don't want to take a bunch of notes home with me. I don't want to see 40, 45 patients in clinic and then have to do 40 notes at home. And now you're working 2 extra hours and taking time away from your family. So, I mean, that sounds awesome. The ability to use that, if it really makes you more efficient. I mean, that's huge.
Yeah, and even I like my notes to have a little bit more detail. And sometimes if you are late on your notes and you're trying to focus on the patient, you don't remember what exactly happened. And this really helps me go back. Hey, this is what I did, and this is what I was thinking, and this is the conversation I had. And now I can write my assessment plan based on the conversation I had because it's summarized for me. So I think there's a lot of talk about AI in medicine, AI in technology, AI in business, and all of us are scared, curious, excited about what AI is going to do for us. What's AI going to do to us? A lot of doctors have this argument or conversation almost every day about, is AI going to replace us? What do you think, man? Is AI going to replace
It's,
us?
yeah, it's a hot button question, right? And it's kind of like an incomplete thing that it's very headline catching. Like, will we be replaced by AI? I mean, I think replacing a doctor and the doctor patient relationship is a far stretch. I mean, will AI replace, or more so, I think, augment some of the skills that we already have or that we could do better? That I think is much more realistic and probable, and probably better in a lot of ways. I mean, as an example, right? In visual diagnosis, in image-based diagnosis, in pattern recognition, like a lot of diagnostic radiology, pathology assessment of slides, even dermatology, which is visual diagnosis of the skin, those things are very well done already. I mean, there's real data, real studies showing exceptional results and even superior performance to humans that these artificial intelligence algorithms can do. But other things, I mean, making a connection with the patient, talking with the patient when a complication occurs, when a side effect of a medication occurs, that counseling aspect. A patient brings up something random that's really troubling them, like the death of a loved one that has interfered with their initial plan to do a surgery. I mean, things like that happen all the time. This is human life. Things occur. I think those things, the ability to pivot and have that emotional connection, that, I mean, it would be hard pressed to be replaced by an AI algorithm. But augmenting our current skills and predictive ability, I mean, those things for sure, I think would be beneficial.
Yeah, we keep hearing this good old saying, medicine is an art. Medicine is science, but medicine is also an art. The science of it is the knowledge that we learn years and years and years educating ourselves on. We read all these books and go through Robbins and our anatomy books and do our training in anatomy and physiology and biochemistry and all these things that we learn. That's the knowledge that we gain over the 8, 9, 10, 12 years that we train. But the art of medicine is also something you learn. Not everyone is good at the art of medicine. Not everyone is good at looking at patient in the eye and telling them when something bad is about to happen, or when something bad had happened and you're trying to tell them the course forward. um, so yeah, a lot of us have knowledge. There's a lot of good doctors that have much more knowledge than I have, and much more knowledge than you have. They know every single study, every single details about the medical aspect of things. But what makes a good doctor is someone who can sit with the patient, show compassion, look them in the eye, and tell them what's going to happen and how they'll be fine, they'll be okay. And that's an art. And I don't know how far AI will go that it'll be able to do that for patients. You
Yeah,
know,
it's a big ask, right? I mean, that's really what being a doctor in a large aspect is converting that knowledge into real human connection and interacting with people in that way. I mean, I think, as a concrete example, things that AI can and already in some ways does very well, like in point of care, acute injuries. For example, a patient comes in after a fall, they think they broke their wrist, they go to an ER and they get an X-ray. Your average ER physician, nothing against ER physicians, does not look at as many x rays of the wrist as an orthopedic surgeon or radiologist. It's simply a matter of volume. They don't. And so their ability to diagnose whether there's a fracture and where the fracture is, the pattern of the fracture, all that stuff is simply not as good. And that's okay. They do a lot of other things. But now, if you had an AI algorithm that could be an extra tool to help you in that setting, whether you're a physician in the ER or a lot of ERs and urgent cares are staffed by ancillary providers, NPs, PAs, it could be a great tool. And that was a study that was done on something like 70,000 x rays, this huge repository of wrist x rays demonstrating if there's a fracture or not. And if that could be a tool to help the physician in the point of care urgent care setting, and it markedly improved their ability to not only diagnose whether there was a fracture or not, but also if this was likely to be an operative injury, meaning higher chance and higher need for them to see a hand or a wrist surgeon soon. And so there's a lot of stuff. That's just one example. But there's a lot of stuff that simple AI tools like this can be an augment and a benefit to our practice, but also our patients.
yeah, I mean, look at the speaking of ER physicians. I mean, ERs are overwhelmed and overloaded. I mean, there's lines out the door.
Totally.
Sometimes patients that are much more complicated are getting missed waiting in the hallway, and sometimes simple little injuries that could be taken care of by someone not as highly trained as an ER doctor that could be managed outside of the ER are being managed in the ER and taking space and time. I mean, AI can play a huge role in triaging early on, offload that ER, assessing things based on initial x-rays and labs and findings that, hey, this patient can be seen by someone as outpatient right away versus someone that needs to be seen by a physician right away. I mean, those kind of algorithms, that's kind of, and that's kind of what a lot of the ER is, right? A lot of it is algorithm based as well. A lot of the early triaging medicine, triage is a lot of algorithm based, and when you're doing that through AI, that can be a huge way to offload not just ERs but primary care physicians, right? I mean, a lot of primary care physicians get calls, get appointments, get overloaded by a lot of simple questions that could be answered by someone that, so it doesn't require a patient to come in, and an AI app that's connected to their physician with the physician's knowledge and supervision can be triaging those patients, answering some simple questions about medications, so the patient does not have to come to the primary care physician, so the primary care physician can focus on those really complicated patients. And I think that's one way that AI will augment our healthcare shortage of doctors that there is right now, or healthcare providers that there is right now.
Yeah, it brings up an interesting point, right? Like if those, I mean, not even if, some of them do exist already, but these AI tools, if they become more ubiquitous, at what point does it become simply a tool that may or may not offload a physician, allow a patient to get a little more direct and immediate information? But if they're still supervised in some way, like a physician is still in some way responsible, this is something I think about a lot. Like, where does the liability fall? Is Microsoft, Google, OpenAI, are these companies ever going to actually take responsibility and liability if an error occurs, if a patient injury, a death, or something occurs because of information that was provided by this machine learning algorithm that simply used a giant data set and a probabilistic model? Is that really going to be something that is medical legally liable? Or is it always going to be the doctor who still remains liable and God forbid something occurs is the one that gets sued, even though they were basically relying on these algorithms. And now they're supervising potentially tons of these algorithms and thousands of patient queries that they didn't have to do before. That's an added element of their job in a way. And it's impossible really to supervise numerous inflows of questions and questions and questions from patients, or patients just checking in. Hey, I saw this on ChatGPT. Hey, I saw this on Gemini. Is this true? Is this legit? Can I do this? I mean, it opens up a whole new Pandora's box of things that potentially could now come down to the physician. Would you want to be liable potentially for something that is said via a large language model? I don't know.
I mean, we live in a litigious society. Doctors take on a lot of responsibility for patients and answering questions. I mean, it's easy to, you hear a lot of people say, oh yeah, my doctor missed it, or my doctor did not diagnose this, my doctor um, told me this, but I looked it up and this was the real thing. So yeah, you're right. I mean, at that point, who takes the blame if a doctor is being, if a hospital system is imposing an AI system, uh, algorithm based ER triage system, and the patient comes in and based on tons of algorithms, something gets missed that was supposed to be seen by a physician and being taken care of right away rather than they get sent home. Who is responsible? Is the hospital responsible? I don't think a corporation will be willing to take on that responsibility. I mean, doctors are always end up being the ones that have to be medically liable for these kind of decisions, and corporations can always say, "Oh, we're not physicians. This was an AI algorithm that was implemented, and it was under the supervision of the physician." So, at what point? You're absolutely right. At what point it becomes too much for a doctor to monitor all, and at what point we can let AI work autonomously, right? Um, that's why I think medicine will be one of the slowest to change, because who will take that responsibility when AI messes up?
Yeah, I mean, really, nobody other than the companies that made the AI should, right? Or it should be a situation where maybe this is too idealistic, but where it shouldn't be a thing in the medical legal environment, right? If you, as a citizen, happily choose to use this software, let's say someone gets advice about chest pain via ChatGPT. And if ChatGPT is somehow integrated down the road, or a tool like it, into the EHR with some method of access, like a MyChart type interface to their physician's office, if they get advice from there, that plays it down. Unlike WebMD, which says basically everything is an emergency, go to the ER. If it plays it down, and the patient does end up having a cardiac event, God forbid dies, something happens, right? What happens then? I mean, the patient did choose to use that rather than actually scheduling a visit and going to the doctor or going to an ER. So at some point, it's a question of personal responsibility, which I think is a huge factor and something that isn't really discussed a lot in this whole space of AI. The buzz and the hype is really about replacement of potential doctors or providers or tools. But where does the responsibility come in? I mean, people are still choosing to use this. There's not a mandate to use this stuff. And so if you choose to use an added tool or a service or software, some of the onus should be on you.
Yeah, I think it'll always be kind of a combined partnership. I was reading this book about AI and medicine, and in that the author gives a pretty good example about there was a professor in one of the small college towns, and he goes to the ER. He's having a lot of abdominal pain, and the abdominal pain, the ER physician checks him out. Hey, it seems like it's a gastritis. Let's take some of these medications, hydrate yourself, rest, follow with your primary care doctor. And the professor was not very convinced, and put in some of his symptoms into AI software, I think ChatGPT. And one of the differential diagnoses that was given to him was appendicitis, which makes sense. And he asked the ER doctor at that point, "Hey, can you please do a CT scan? Because based on my symptoms, I think it's appendicitis from what the AI software is telling me." So the ER doctor ended up doing a CT scan and ended up being appendicitis, and he was taken for surgery. So at this point, I mean, it's physicians do miss things without AI. Physicians may miss things with AI. We'll just have to find a balance with patient partnership of how to use these tools to the best of our ability. Sometimes patients will have to understand, and they'll have to take some ownership of what they're asking and what they're requesting, because sometimes you might end up doing a lot more CTs than you don't, and you might find some kind of incidental nodule that end up might getting biopsied, and because the patient requested a CT scan. And then who is to blame, right? Because the doctor listened to the patient's request, because ChatGPT told them it could be appendicitis, and then they found this possible non-cancerous mass that did not need all this workup. So it'll be an interesting surge. I don't think I have answers to that yet.
Yeah, I mean, I don't think anyone does, but I mean, they're interesting and they're important questions, you know. Like even if you delve a little bit into the weeds of AI and how a lot of these algorithms are actually created and how these softwares work, a big question is like they're only as good as the data you put in. In a little more simplistic sense, it's kind of like any PubMed or literature study that's based off a database. The study and the outcomes and the results of the study and their ability to apply to mine in your practice are only as good as the initial data set that was put into it. It's the exact same thing with AI. AI is nothing but analyzing these massive data sets and coming up with a method to analyze them with high probability of success. And so if your initial data set, even if it's huge, if it's for some reason not generalizable to the population at large, then you can really only use AI with high fidelity if you ask it about questions relating to that initial data set. So if you don't have real generalizable data, you're going to get inadequate information. And one thing that AI does, and this is one of the known problems with AI, I've done a lot of AI research, and one of the issues you come into is called overfitting, where the AI algorithm itself, its goal is to give you a response. Its goal is not to give you the right response. Its primary goal is to give you a response. And so it will overfit. It will fit itself to the peculiarities within your set of data, and it will only give a response based off that. But it won't tell you that because it can't know that. It doesn't know what exists outside of that data. And so it may not apply to the population at large. It may only apply to that very select little cohort, but the person asking it, a patient or myself in this case, and the AI algorithm itself are unaware of this.
Yeah, but if you think about it, Adil, aren't we all kind of same, where there's certain sets of data that have been input into us, and we've learned through our experiences of seeing patients, and the books we've read, and the articles we read, and the studies we read, and the research we've done. We're taking those experiences and that data to help patients, right? So how's AI any different? Maybe just a version where a version of software that can process a lot more information than we can, right?
For sure.
Maybe the AI yet does not have the real life examples of seeing patients and seeing their body language and seeing their physical symptoms and kind of having a hunch about their symptoms and kind of using that hunch to maybe order some tests and diagnose them yet. But at some point it will,
No,
because
for
there's
sure, and that's a very good point. I mean, these AI things, these algorithms, these softwares, they are self-correcting, right? They learn as they go, and that's a huge benefit. In a way, it's kind of like how humans learn. We learn as we go through experience. But if we create a tool, for example, to assess someone's risk of a cardiac event or assess someone's risk of a fragility fracture, and we feed it whatever demographic data, imaging, blah 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 from the outset, initially that tool is only going to have that data. It's not going to have other population data. It's only going to be limited to whatever, if we decided to come up with it, whatever we could think of at the time. It would be limited by its human creators, who are naturally flawed.
Yeah, and we are limited by our own biases too. I mean, it's a known fact that women of color tend to get treated differently with chest pain compared to a white male, right? People have their own biases, and maybe in the United States that's the way. Maybe in Africa that's not the case, right? So wherever that data is going into the physicians and the biases that they go through throughout their training, those take a role in when they make that decision in medical care. And I think AI will be the same way. It'll have its own biases, and who knows? I mean, a lot of times I use a lot of ChatGPT, Gemini, and a lot of these things, and some of the previous questions I've asked it, it keeps that in mind when giving me answers, right? So if I've looked up a lot of information about cancer in the past, will it tailor the response based on my previous searches and the information I've been concerned about? That will be a interesting thing as well, because if I'm a person that looks up, am I going to have a heart attack, am I going to have a heart attack, am I going to have what's my risk of a heart attack, and then when I look up symptoms of chest pain, it indicates towards me having a heart attack versus something else, maybe something like costochondritis. So how much of your own biases will it take
Yeah,
in?
no, that's a good point. Like, how much does the recency effect kick in? And I mean, it affects humans. That's a known thing. Like, whatever we're focused on thinking about, researching, reading in recent memory, we tend to try to find it. We tend to see those examples in real life more often just because our mind is set on it. Perhaps these algorithms are the same way.
Yeah, so it's interesting, but I think there's another aspect of AI to think about as physicians. I think there's two things AI will do. I think it will give physicians a lot more autonomy to be able to go independent on their own, because the barrier to entry into private practice, into entrepreneurship, will be much lower with the advent of AI. Just to give you an example, when a patient comes in and they make an appointment, there's a whole process of a human having to call another human at an insurance company, giving that patient's information and writing down their benefits and putting them into the EMR, so then the office can see how much will the patient pay at their first visit or for a procedure, getting prior authorizations, taking in calls, collecting the information. It requires a lot of human time and capital. Uh, with AI, those things will become much easier, much low cost. For a person to be able to set shop, use simple softwares to set their clinic up and start seeing patients, right? But on the other hand, in big corporations and in big systems, and through insurance companies, it'll be easy to monitor doctors pretty closely, right? If I'm using a AI software that's listening to the whole conversation and assessing and writing a note for me, and if everyone is using that through the EMR, then insurance companies will exactly know how long I've spent time with the patient, what kind of complex conversation I had, and how I should be billing for it. And hospital systems can definitely assess physician efficiency. Why did you talk to a patient about their children's baseball game? That was a waste of time. You should have spent less time doing that, and you wasted 3 minutes doing that. Instead, you could have seen another patient in that time. So there's good and bad. There could be a lot more corporate control of physicians, and maybe a lot more physician autonomy in some ways.
Yeah, I mean the subverting of AI to create a type of surveillance, like a Big Brother type scenario. That's an interesting thought. I hadn't even thought about that, but that I mean it's a potentially scary thought if you think about it. That we adopt these tools to make ourselves, in theory, more efficient on a case by case basis and to help more patients. Right? Our goal is to see more people. More people can get in. The wait times decrease. I don't have to wait as long to see my patients. But then if they're used like this by, the powers that be, the employers, the administration, whatever, just to their goal is to make the enterprise more efficient, the bottom line, those are conflicting, very much so. And that's usually the problem in healthcare in general, AI or not, is the doctor-patient relationship is often at odds with the corporate bottom line. And if AI is used in that manner, I mean, it could put even a further roadblock on a good doctor-patient relationship and convert it even more into an assembly line type model.
Yeah. At that point, I mean, uh, would you it's going to be tough for us to kind of manage our time then and be able to have that personalized conversation with the patient. But I do want to also think positively about the idea of having more autonomy. I mean, I don't have to hire two people right off the bat. I don't have to pay another company to manage my billing when all I have to do is come in, have a lot of AI bots, one maybe answering phone calls, one maybe doing benefits verification, and one maybe making calls and setting up procedures where I can come in, see patients, and maybe just hire one nurse who can room my patients. I can have maybe possibly multiple computer screens set up in my office where they can patients can come in and they can talk to a AI version of me on the computer, asking the same exact questions I would be asking six patients at a time, and create a summary for me to go in and
Dude,
counsel
I,
them.
I, I love the idea of that. It's like we would have a Humayun version of Iron Man. It's like instead of Tony Stark, it's Humayun in his clinic with his white coat on in multiple rooms. It's like his version of Jarvis just talking to the patients.
Yeah, I mean, you can have a hologram of me in there, six different versions of me who have been taught by me, have been taught by my knowledge, my personality, and they've been trained by that, and they're in the room talking to the patient, collecting all the same information I would, and then for the patient's reassurance, and I can go in based on the report that I've received and the suggestions that I have, I can sign off on those. Talk to them and why I think that is a good idea. If they have questions, maybe answer those, and that way I can maybe see six patients at the same time, and I don't have to worry about maybe instead of having doing 40 hours of work week, I have a 20-hour work week. I can spend more time with my family. I can do more things, more work, thinking about the deeper meaning of life rather
Do more
rather
podcasting.
yeah, maybe I can spend more time podcasting with you rather than
Yeah,
having to.
it's funny. Like, there was I forget, gosh, I forget where this was. Somewhere, I think it was in Chicago, Mayo. But there was actually an orthopedic surgeon who, this was before AI. This was like, I don't know, maybe in like the mid '90s, late '90s. But he basically realized that he was the rate limiting step in his clinic, that he had to see the patients, talk to them about surgery, sign them up. So what he did is he basically came up with a series of videos, like 2 3 minute long videos of the 20 most commonly asked questions that the patients would ask him. And he did pretty straightforward hip and knee replacement. So it was not a huge breadth of variety in these questions, right? It was these are the main heavy hitters. And he just uploaded these little video clips of himself in all the computers in the rooms. And he would just have his MAs go into the rooms and just start playing the videos. That'd be the whole patient visit. And he would just briefly pop his head in. Any other questions? And if they asked a question that was answered in the video, he would just scroll real quick, click the video, and then leave the room and go to the next room. It seems crazy. And obviously, like, it was very off putting to many of the patients. But this would be, I mean, obviously not with the purpose of just running an assembly line, but this would be increased access to patients, what you're describing. I mean, in the future, but it would be more personal because it wouldn't just be a static video recorded in the past. It would actually be you or a likeness of you, that had learned and adapt and continues to just as you do. It would be like your surrogate in a way. But I mean, it's an interesting idea for sure.
Yeah, I've thought about a lot of these things, and there's tons of things you can talk about, but one thing that always kind of boggles my mind and I think about is in mental health, how grieving when someone dies is such a big deal, right? I mean, when you lose someone you love, um, that's a big mental health change in your life. You know, it can cause depression. A lot of people. Some people just have a hard time letting go. Some people have a hard time grieving and miss people that they have. I mean, there's already things that Meta is doing, for example, in virtual reality, where you can talk to an AI avatar that just exactly looks like the person that you love and know. And they can be talking wearing their own headset, and it'll be emulating them in front of you on a virtual headset. Now imagine teaching the avatar your personality, and the things that you like, the quirks, your ideas, your wisdom, and it learning about it, and then leaving that for your loved ones to come to you for advice once you're dead.
Yeah, I mean,
You know,
it's like a deep fake, but without the negative connotations that we associate the term deep fake with. It's like a legitimate, real mimic of their personality.
it's a mimic of the personality, maybe a way for people to slowly let go of you, slowly go get through the grieving process, maybe even go back to you if they have any questions. Always have your dad, your brother, your mom with you to go to if you want to spend some time with them. Yeah, maybe it's twisted in a way that you never really learn how to let go of them, but it could be therapeutic for some people who finally learn how to let go, but then know that comfort of being able to talk to their loved ones.
Yeah,
Uh,
or even, if you think, like, what if someone, like a child, one of their parents died when they were still a child and never really had an ability to build that interaction as they grew up and have a formative relationship, like as they became a teenager or something, but the image and likeness was preserved with the advent of AI. That would be
yeah,
pretty
I mean,
interesting.
we'll have to see what kind of mental health effects that has on people. But it's some things to think about. I mean, the what I've learned through the past, and as millennials, we're one of the generations that has seen so many changes. I mean, I still remember some of the early stages of a phone where you had to do the rotary dial, and from that to a wireless phone, and then cell phone, then iPhone. Now, don't I can talk to patients from my people from my glasses,
Dude, did
right?
you do you remember the car phones? Like the old
The
school
car
car that
phones
was like
with the
in,
wires,
in
yeah,
the car, yeah, with the wires?
yeah.
We
So
had
we've
one,
seen that,
but we
right?
never got it set up. It never worked. My brother and I
Yeah.
would just mess with it and pretend we were on the phone.
Yeah, so we've seen that, right? We've seen the three different stages. We've seen the internet revolution. Now we're living through the AI revolution. So now, I think nothing is impossible. Like, I mean, just imagine a scenario in your head, and it can possibly happen, right? There are some things I used to think that could never happen, and now they're happening. So I've stopped limiting the thought and ideas that, oh yeah, this could not ever happen. um, just with the way things are moving, there's so many different things that could happen. What excites me a little bit more, coming back to medicine, is the use of AI in research. And advancing. You do a lot of AI research. I mean, you're using a lot of AI tools and doing some research on AI, but AI and research can really fasten things and maybe find cures for things, find uses of medications, uses of supplements, uses of procedures that we weren't even thinking of, right? Uh,
Yeah, totally. I mean, there's even companies that are dedicated specifically to that. That these AI companies, they primarily contract with like these huge academic medical centers like Mayo Clinic, MD Anderson, these centers, because these centers have the best currency. They have data. They have huge amounts of data on patients of all kinds. And so a lot of what these companies want is they want access to that data. And they run through the data, they identify, like you're talking about, clinical trial targets, whether for drug design or radiation therapy, whatever it is, but they can just comb through this data way better than any human could. And the question in this realm becomes who owns that data? Because in the past, actually, a lot of these academic centers, they would just sell the data in some de identified manner, and it would then become the property of these AI companies. And now they hold actually the most valuable resource. In more recent years, these centers like MD Anderson have realized keeping the data is the most important thing. You can contract with these companies that they can search your data and identify targets for these things, but keeping your data is the most critical thing because that's what these AI sets are trained on.
yeah, yeah. I mean, the data game is the strongest. I mean, someone once told me that the reason Tesla stock is so valuable because Tesla is not a car company. it's a data company. It's a company that's collecting data on traffic, on cars, on, and that data is so valuable. Just like that, the data in medicine that is being collected through clinical trials, and then that being processed through the AI softwares, it's the most valuable thing. And a lot of the companies will be betting a lot of money on it. I think there was this company on Shark Tank, I think a few years back, that was collecting data on cat DNA, and cats, different breeds, and what cats like, and what kind of medications could be used. And all it did was collect. And this, at that time, a lot of, I don't think a lot of people bet big on that company, but that company had $1 billion exit recently because
For the
all the,
cat genome, a billion
for the
dollar
cat
exit?
genome, because so
Really?
many different medications, so many different food types were created
Wow.
because of that data that was available. So
Dude,
just like that,
Purina cat chow, baby.
yeah. I mean, that was a big scare with 23andMe when 23andMe went bankrupt. There was a big scare about where that data is going to go and what's going to happen to all those DNA samples. And they even offered to be able to delete all that data and destroy your DNA. And they gave that option to people to, because once they were going to get bought out or transferred, no one knew what's going to happen to the data. So that's a scary thought. I mean, it's a scary thought, but it's also a hopeful thought, because I think a lot of good can come out of the data, right?
Well, for sure, yeah. I mean, it's like, a lot of the research that I've done in the last couple of years is on like how patients use artificial intelligence. Like patients, rather than just asking their primary care doctor, scheduling a visit, going to an orthopedic surgeon, they'll just query ChatGPT or Gemini and things like this, and ask it like, what should I do about my shoulder osteoarthritis? What should I do about my scaphoid fracture in my wrist? And so we basically looked at some of the most common questions that patients ask regarding conditions like this, and how accurate were the responses that these AI algorithms spit out. And I mean, they are actually remarkably accurate. And we assess them on both accuracy and completeness, because not only do you want to know if the response that was given is correct or not, but also like, is it missing a lot of stuff? And in fact, it was very accurate and complete for the vast majority of things, which basically can help guide patients. I mean, it even provided initial treatment options like start with physical therapy. You can do these exercises. Here's a link. I can even come up with a custom physical therapy protocol for you. Here's some tools you can use. I mean, like everything that they would essentially get for these simple treatment options. Obviously, it can't do invasive stuff. It can't do surgery. It can't do injections. It can't obtain or interpret imaging, but it had all of these initial very basic steps for patients to take, and without ever seeing a doctor. And for the most
Yeah.
part, they were actually quite accurate.
I mean, yeah, I'm giving a lot of my data through this thing right here. I wear the Whoop all the time. I've been wearing it for a year, and a lot of insights I get on my health through that is pretty amazing. But I know that data is going somewhere. It's going to Whoop, and they could sell it. And use that data for maybe betterment, maybe coming up with a little bit more information about our health. They recently came out with this system where they can now monitor your blood pressure. All I have to do is check my blood pressure and input it into the app a few times at different timings, and they can predict what my blood pressure is at a certain time. And that makes me wonder a lot about wearables and the role of wearables in cardiology, because big thing, atrial fibrillation detection, that's already happening with Apple watches, right? Some of them, some of the EKGs and AFib detection getting FDA approval as well, or FDA clearance. But in the future, it's going to get better. I mean, I put on Holter monitors for my patients, but in the future, the wearables will always be able to detect AFib, and that's a big cause of strokes in patients, right? Heart failure is a big deal. Heart failure hospitalizations in patients is a big deal, and there's a lot of work being done in that, on how wearables and different and blood pressure readings and weight readings can predict heart failure hospitalizations. In my clinic, a lot of my patients get patients who have heart failure or hypertension. I provide them with a blood pressure cuff and a weight monitor to check their weight and blood pressure daily. So that data gets transmitted to me every day, and my nurses monitor that data all the time. And if someone's blood pressure is persistently high and I can see their weight rising, I know they're heading towards a heart failure hospitalization, a heart failure exacerbation, and I can right there and then get in and act on it, tell them to take their diuretics, bring them in, improve, change their blood pressure medications, and prevent that heart failure hospitalizations.
So that right there is like a potential, use case for AI rather than having a nurse or someone physically go in and check every so often these metrics or whatever cutoffs you set as an alert and these metrics, it could be automated
Oh
using
yeah,
AI, I
it
mean,
already is. It already is. It already is in a way that there's a lot of devices. I mean, a lot of patients' pacemakers have thoracic impedance set up in there where it can measure the pressure in someone's chest rising, and they can alert the cardiologist that the thoracic impedance is rising, and the cardiologist can right away act on it by diuresing them a little better at home. Um, but the same is going to happen with wearable device where someone like maybe not having a pacemaker implanted, but just by wearing a band like this can, and maybe checking their blood pressure or weight every day, can stay out of the hospital, stay healthier, live a better longer life. um, and that kind of comes into maintain their health. Another good way patients can benefit is, as a cardiologist, as a physician, I can get better data from my EMR. Right now, my EMR is a billing tool. I mean, all I'm doing is writing patient's information for the sake of billing and maybe sending the reports to the referring doctors. But in the future, I can have my EMR work for me and work for my patients. I can have plugins or softwares within built into the EMR that can tell me, hey, 50% of your patients have a LDL or bad cholesterol higher than 70, even though they have heart disease. Why don't you bring them in and improve their numbers a little better? And can maybe highlight certain patients that need a little bit more urgent care based on their labs and their metrics. And that EMR can do two things. It can help me improve my patients' health by preventing hospitalizations, preventing preventable illnesses like hypertension causing heart failure. It can improve my business as well. I can have patients come in more often, identify patients that were lost to follow up, bring them in because I can give them exact examples of how I can improve their health, and what needs to be done. Right. So those are the kind of things I think AI will improve healthcare in a lot of ways. There's a lot of negative aspects to it, but there's a lot of good things as well.
no, for sure. I mean, I'm way more excited about all the positives. Like, it's important to talk about the negatives, like some of the stuff we've been highlighting. But I think the ability for increased efficiency, the ability to automate so many things, the ability for direct and instant communication, I think is huge. That's such a common complaint that patients have, and even myself, when I am a patient or one of my family members is a patient, just the inability to talk to your doctor when you aren't physically in the room in in that 10-minute, 15-minute window that the doctor's sitting in front of you. Like, so many people have questions after the fact. Or you get an imaging study of your labs. You want to talk about it. You want to know, is everything okay? One value is on the cusp of normal, not normal. What does it mean? Is it okay? Do I need to do anything? All of these things. It's very difficult for patients to try to speak to the doctor because there's so many different staff that are responsible for communication after hours with the physician or the physician's team. Some are more responsive than others. Some give complete, incomplete responses. Some will communicate directly with the physician and make sure this is appropriate or not for me to give this response. And some won't. I mean, there's so much variability. I think if there was, and I'm sure there are already ways and they're improving for AI to help with that aspect too. Just the ability of patients to get their questions answered, I think is huge, is very important.
Yeah, for sure. I mean, people a lot of times come to the doctor for that reassurance. Sometimes they know they might be okay. This is just something they're nervous about. A lot of people come to say, I'm sure this is just me being nervous or me having a panic attack. I just want some reassurance. And yeah, and if I can just go in there, look them in the eye, and provide them that reassurance instead of being on my computer and just typing away, their whole story, and just and then not being overloaded by the idea of having to do all the work, uh, being offloaded by the need to write the notes, need to read all my imaging studies, need to make sure the staff is doing their job by making sure the benefits are verified, and then patients are not complaining about the insurance charges. If that's all offloaded from me and I can just focus on patient care and be there for the reassurance, then I can just be a better physician, a better doctor, and provide better care. So uh, I think we as a healthcare community need to learn that these things, we we can either use them in the right way and make our life easier, or complain about them that they might replace us, and just kind of reject these things and then be left behind, and that not provide patients that benefit that it could provide in the future based on all these things that could happen. So I think I'm pretty positive, very optimistic about this. And if it maybe replaces me as a physician, but helps me as an entrepreneur make a better healthcare entity, I'm all for it.
There you go, baby. Humayun Stark, the Iron Man of
So
medicine.
the idea of six different versions of me in the room at the same
I
time
like it. I
is
like it,
really
man. I like
exciting.
it. No, this
Well,
is good.
maybe the in the future will be the two different versions of us holograms doing this podcast. But
Yeah,
until now,
exactly.
it's real us in the flesh.
Yeah, yeah. Two docs, several AIs, one mic.
All
All right, man.
right.
This was a good episode. Let's wrap it up. Thanks for tuning in, guys, to Two Docs, One Mic. We'll see you next time.